fact, part of the effort that we're making right now to contain and delay any kind of community outbreak is really to allow the healthcare system to get through what we are seeing as a significant influenza season. If we can delay, obviously, community transmission to beyond the normal, typical flu season, then we can actually provide some slack in the healthcare system to address things like shortages of beds and you know, the burden on healthcare systems that oftentimes flu season exacerbates. In terms of equipment that I know hospitals have talked about, that is one of the roles that the federal government can play and is actively investigating and preparing for right now. Things like ensuring that we have adequate personal protective equipment for frontline workers and additional ventilators should people get to the point where they need to be you know, intensively cared for if they have a severe expression of the illness. So I'll turn to Dr. Tam, maybe want to provide a few extra words about that work.
Well, I think, Minister, you provided quite a comprehensive answer. Only to say that everyone actually has a role to play. So I think part of this is that don't show up in the emergency room when you are sick with COVID-19 symptoms. Call ahead and make sure that you're not negatively impacting those health care facilities. And some patients, in fact, a vast majority of people with COVID-19 have milder symptoms, and such patients can be cared for in the community while reserving, of course, very scarce resources potentially for those who really need it. So I think everybody can sort of play the role in helping the health system. But having said that, every jurisdiction, every province is looking at all of their pandemic planning assumptions. They're looking at what kind of requirements they may have in terms of beds. But they are going to have to coordinate what's going on in the hospitals in terms of, for example, they may need to make decisions about postponing elective surgeries. And there's a whole number of things that hospitals have already planned for before, and we'll be sort of looking at it with a fresh eye as we understand the science of this virus a little bit more. But certainly protecting the health system, protecting, I would say, long-term care facilities too is very important with this particular virus.
Yeah, and I just want to pick up on something Dr. Tam has said. You know, we are very mindful that this is really about strong and close cooperation between the provinces and the federal government. As I said, Minister Hajdu has been working very closely with her provincial counterparts. I have been, and the Prime Minister has been, in touch with premiers. We are very mindful of the fact that this is going to be an issue where, when it comes to our health care, we have to work effectively together. We're doing that. It is a very good thing that we have a First Ministers meeting next week, and the federal government very much understands our responsibility to provide leadership and coordination, and that's what we're doing. And I really want to say the cooperation with the provinces has been terrific. The provinces are very focused on this. They're really stepping up. I don't know if Patty wants to say anything about the provincial health ministers.
Questions to the experts, and our lifestyle reporter Megan Coley joins us now with more. Good morning, Megan. Thank you so much for joining us. So let's start there. How effective are these hand sanitizers? I mean, how effective are they in protecting against the virus?
So they are very effective. It's a great option if you know you're on a busy commute, on public transit, or you're in another space where there are a lot of people and potentially a lot of germs. But ultimately, public health officials are pushing that hand washing is best with soap and water.
And it's good just to do that all the time anyway, no matter what. But, you know, talk about these hand sanitizers. People are making their own.
That's right.
Explain
so
that.
There are some do-it-yourself recipes sort of circulating online amid fears, rising fears. The World Health Organization does have a recommendation, an official recommendation for how to do so, but it's really intended more for populations around the world that don't have access to medical grade hand sanitizer. So it's not really recommended for you know, people in the GTA if they can go and buy hand sanitizer from the store.
All right, so what are officials as well talking about, you know, saying about household cleaners? People make their own when it comes to those as well. How effective are they saying?
So household cleaners are great. Again, the point we really want to drive home here is practicing good hygiene. You should be doing this all the time, but now more than ever, it's great to keep spaces where a lot of people from a lot of different places might be touching. So I'm talking about, you know, desks at a receptionist, in a doctor's office, things like that. The key here with household cleaners is really making sure you're using the right cleaner for the right surface. So you wouldn't use, say, a toilet bowl cleaner on a kitchen counter, for example.
Yeah, I mean, it should go without saying for a lot of people. But here's another question, and we've seen a lot of people stockpiling on masks, and you see a lot of stores now offering these. What are officials saying about the efficacy when it comes to those?
So again, you brought up a great point earlier. These are really intended for people with lower immune systems, weaker immune systems, or people who are sick. The problem now is that we're running out, and it can be taken away from people who actually need these products. So again, practicing good hygiene is your #1 defense against coronavirus. Washing your hands as often as possible, using hand sanitizer in between, and trying to stay away from people who are coughing.
How would you characterize, I guess, the level of fear among, I don't mean, that's not even the right word, but the sentiment for health officials? Are they trying to downplay the hysteria when you pose these questions?
It's a great question. So what we're hearing from public health officials in Canada right now is that the risk of infection is still very low for individuals, especially if you're a healthy, generally healthy person. So yeah, we are, you know, wanting to make people aware of the risk, but again, it is still very low. And I think the general sentiment is just not to panic and keep practicing that good hygiene that you should be practicing year round, but especially during this time anyway, just because of the normal flu.
Megan, thank you so much. Megan Coley from our online team, and we really appreciate your insight on this.
Thanks for having me.
So for you at home, you can learn more about these products and protecting against COVID-19 by visiting our website, globalnews.ca.